We're live.
Thank you. Good morning, and welcome board and online viewers to the July 1st, 2026 Board of Health meeting. The board meeting is officially called at 8:01, and this virtual meeting is being streamed via YouTube. The June minutes were distributed to the board for the review prior to the meeting. And please remember that in compliance with the Open Meeting Act, we are required for every voting person or member to be seen and heard. Also a reminder that we're going to have three moments for votes today, and the voting involves only the board members, those who have been appointed by the mayor and who were confirmed by Metro Council. So are there any discussions or amendments to the minutes as they were distributed?
I move adoption.
Second.
May have a second. Thank you. All in favor, please raise your hand and say aye and just hold it there.
Aye.
Aye.
Aye. Any abstentions? And we have a quorum, and the motion is approved as distributed. The second event, or the second moment to vote, we're going to proceed to elect the next Louisville Metro Public Health and Wellness Board of Health Chair and Vice Chair. The nominations are, as we share with the introduction for this meeting, the candidate for chair is Ms. Karen Haskell. She's been 40 years working in the fields of substance abuse treatment, and she currently serves as president and CEO of the Healing Place. May I have a motion to elect Ms. Karen Haskell to be elected as the Louisville Metro Public Health and Wellness Board of Health Chair?
Riddick moves.
Second.
Just a moment. Mr. Reddick, you are not eligible to make the motion. So if I could get
So may I
someone
have
else
a
to make a
move?
motion.
I'll make a
Dr.
motion.
Shah? Okay.
Second.
Dr. Ransdell? Okay.
I'll
Second,
second.
Dr. Eccles? And second, Dr. Ransdell, too. All those in favor to elect Ms. Karen Haskell as the new chair for the Louisville Metro Board of Health, please raise your hands and say aye.
Aye.
Aye. Do we have any opposed? And if not, we are electing Ms. Karen Haskell as the new chair for the Board of Health. Congratulations, Ms.
Thank
Karen
you very
Haskell.
much. I appreciate it. Thank you.
Appreciate it. And then the candidate for vice chair is Dr. James Randy Ransdell. He is the co-founder of Louisville Free Smiles Clinic, with a conjunction with Family Community Clinic, continues to provide free dental care services to the underserved Metro Louisville population. Both candidates were chosen based on the regularly presence and participation to the meetings. So may I have a motion to approve and elect Dr. James Randy Ransdell to be elected at Louisville Metro Public Health and Wellness Board of Chair? We
So
have
moved.
a motion to move by
Yeah.
Ms.
Second.
Haskell. Second, Ms. Dr. Eccles and Dr. Shah. All those in favor to elect Dr. Ransdell as Vice Chair for Louisville Metro Public Health and Wellness, say aye.
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 Thank you very much. Congratulations, Dr. Ransdell. Thank you so much for becoming our new Vice Chair for Louisville Metro Public Health and Wellness. And now we're going to proceed to confirm, since Family Health Center has requested for the Board of Health to vote and confirm the reappointment of several members of its board for its boards of directors. We've had the bios and the registrations for these positions. I hope you had the opportunity to review them. And this group of individuals have been serving already as members of the Board of Health. So may I have a move to confirm the reappointment of this Dr. Muriel Harris, Miss Michelle Hoagland, Mr. Christopher Rossman, Mr. Anthony Walker, and Mr. Mike Fung. Do I have a motion to approve and confirm these individuals as part of, to be reappointed as part of the Board of Directors for Family Health Center? May I have a motion?
So moved.
Thank you, Ms. Thank you, Ms. Margaret. Thank you, Ms.
Second.
Dr. Shah.
Second.
Okay, all in favor, please raise your hand. Say aye.
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 Thank you so much. Do we have everybody? Ms. Arlana? Yes, now we
Yes,
have
ma'am.
Dr. Burns. Thank you very much. And Dr. Muriel Harris, Ms. Michelle Hoagland, Mr. Christopher Rosman, Mr. Anthony Walker, and Mr. Mike Fong have been reappointed as Board of Directors for Family Health Center. Thank you very much. July is and now we are in a very hot part of the year. July 4th, it's going to be the celebration for the U.S. Independence Day. And this year we're celebrating 250 years since the signing of the Declaration of Independence in 1776. So let's go and be grateful and celebrate. July 11 will be celebrated all around the world. It's World Population Day, and it's a United Nations designated observance focused on global population trends and the relationship to equity, health, and sustainability. Sustainability is the key part in this sentence. And also, July is the Disability Pride Awareness Month, and it's emphasizing visibility, self-advocacy, and social model of disability, recognizing the barriers that are often created by systems, not individuals. So be aware, let's support. And we are going to go to our perspective sessions. Our perspective session for this month is presented by Ms. Ashley Webb. She's the Deputy Director at the Office of Violence Prevention with Louisville Metro. She'll be talking about the Office of Violence Prevention and the impact on the public health of the city by this office. Ms. Ashley Webb has been with the Office of Violence Prevention since 2024. She brings a wide range of experience across public service, from working directly with families as a family resource coordinator to leading child-focused policy and programs at the Kentucky Cabinet for Health and Family Services. She has also served as Assistant Director of the Office of Energy Policy, and she has graduated from the University of Louisville, where she studied sociology with focus on social deviance. But most importantly, Ashley's work is grounded in her lived experiences as a foster and adoptive mother. Our recognition to you, which continues to shape her passion for supporting children, families, and communities. Today, I present to you Ms. Ashley Webb. Welcome, Ms. Webb. If you have a presentation, please share it. You're going to have 20 minutes. And before she starts, our technical support guide, Catalina Cordova, will share a video regarding the Office of Violence Prevention. Go ahead, Kathy. There is no sound. Kathy, there is no sound. What we can do is maybe we can share the link of the video to all the participants, and we may go ahead with Ms. Webb with her presentation.
Sure, I will go ahead and share my screen. The video that you're seeing, and hopefully you all have the time to maybe take a glance at that later, is showcasing some of our street outreach from Goodwill. And I'm going to get into that a little bit later, but it does give you more of a sense of what the work looks like in real time. And bear with me so I can get started. I don't typically like to present with PowerPoints, so I will say that it is up here, but I'm probably just going to conversationally tell everyone sort of how we fit into the public health model in Louisville in really reducing harm upstream for Louisville's, quite frankly, most risk-involved and vulnerable populations. So the Office of Violence Prevention's mission statement is to prevent violence by identifying and addressing the complex factors related to violence across our city. And our office coordinates very heavily across the city. Again, I'll talk about that a little bit later, but with organizations, communities, and individuals to address the root causes of violence and provide resources and programming to encourage strength, resilience, and recovery. I will say that everything that we do is a very holistic and complex approach. So, as I stated, our mission, but every act of violence and every incident is something that creates trauma, not just in an individual's life, but in those that are connected to that individual and those in the community. It creates chronic stress and long-term health harm. And so our work focuses very deeply on the upstream prevention to reduce harm before it becomes disease. But again, we also are in the midst of it with intervention. And we fall into Louisville's Safe Louisville plan. And I apologize, this is not the presentation that I thought it to be. So it should not say Safer Louisville. It should say the plan for a safe Louisville. But it does create a safer Louisville. And the way that we fall into that is our office leads a significant amount of strategy across agencies. We sync with LMPD's crime plan to ensure that we are reaching the highest affected areas. We track outcomes, and I'm going to showcase those to you in just a moment. And we support intervention programs, as well as Safe Louisville really focuses on the prevention aspect. So I'm not sure if you all have had a presentation on Safe Louisville, but it focuses in a citywide effort, which is a beautiful thing because, as we know, people don't come to us in pieces, and so we don't want to serve them in pieces. And agencies across Louisville are working strategically on prevention, intervention, and enforcement. And the Office of Violence Prevention specifically focuses on the prevention and intervention aspects of violence reduction. So this right here is our violence dashboard. And, you know, I am going to escape out of this because it does not seem that this is the slide deck that I would like to be working from. So bear with me for just a moment. I apologize.
No worries. No worries.
You know what? Would it be possible for you all to share the screen of the one and be the driver? If not,
I
that is
have the
absolutely
same one. I have the same one.
goodness. Okay, give me one moment then.
Oh, Catalina, actually, it's different. I was following along. It does say
Yeah,
a
there
plan
should
for a
be
safe
a link
Louisville.
on the
So I think she
dash.
said that's the correct one.
Nothing like some technical difficulties.
We
Oh, you
will
know what?
overcome
I
this.
have it. I am pulling up the
Okay,
correct one right now. So
great. Thank
let
you.
me just get it screen shared and we will get back to good. Thank you all for bearing with me. So close. I think we're back in business. Can you all see my screen?
Yes.
Yes.
Okay, wonderful. Oh, well, that did not work. I'm trying to pull up our dashboard. And it is not. Oh my.
Can you talk us through it?
Well, I want to bring up a live dashboard so that I can walk you through the actual data. So I'm going to just see if I can pull that up directly. I would love for you all to have the ability to navigate should you ever need to. I am shifting us over. I'm going to try this one more time and then I'm just going to give up on it.
Ms. Webb, I will also send that presentation to the board members so that they can have it and then they can have access to the dashboard as well.
Sure. I'm trying to pull it up directly from online and it's not showing me where I can. Can you all see the
Yes.
screen
Yes,
where it
ma'am.
says year-to-date
Yes, ma'am.
violence
Yes.
table?
Yes.
Yes.
Okay. I would not have taken up so much time trying to figure that out, but I do feel that this is extremely important. So most of us, our work is very grounded in data, if you will. And for our office specifically, that is extremely important. And so we have a gun violence dashboard, and it is updated on a daily basis. This is something that everyone on this call can access every single day. You can just go to the Office of Violence Prevention, and you will see over on the left tab where it says Louisville Gun Violence Dashboard. What I'd like to do is walk you through this so that you have the ability to see in real time where we're at today, how much progress we've made. And I want to emphasize that this is a citywide effort. It has required an entire ecosystem working together. And the Office of Violence Prevention is a very strong part of that ecosystem, as we specifically devote the majority of our efforts to the neighborhoods that have been impacted by violence the most historically. And I will be able to showcase to you what that looks like. So if you see right here, we are looking at homicides year to date, and we are down by 10% citywide. Now, that is a tremendous improvement, specifically when you look at last year. Last year, we were down by 40% year to date at this point, and we're halfway through the year, over halfway through the year. The reason I showcase that is because to have sustained at the 40% down would have been a tremendous improvement in the city of Louisville. But not only did we sustain the level of reduction, we have reduced another 10%. Now, speaking the language of public health, looking at the years that we were impacted by COVID, you can see that the violence spiked and was at its highest peak. And that showcases that so many of the elements in regards to violence are, influenced by things such as social isolation, not being in the workforce, not having the ability to be in the workforce. There is much to do in regards to youth and being connected to healthy peers. And when they were pulled out of their school environments over those years, and, we saw substance misuse increase, we also saw that these impacted violence numbers. And so the work to get those back to pre-COVID has again required a very focused plan. And we're going to talk about what we do specifically, but I want to show you a few more data points first and also showcase how to navigate this dashboard. So you can go onto the dashboard and select homicide and non-fatal, and you'll see if you put both of those together, we are at a reduction year to date by 17%. It was and is the goal of the city to reduce violence by 15%, gun violence 15% year over year, and we are doing that with a concerted effort. If we come down here, we can navigate this data a little bit further. And so I'm going to talk about our CVI sites, but virtually what that means is we have 6 sites across the city that we selected based on historic gun violence data. So those neighborhoods that had the highest level of gun violence. And in some cases, we looked at some other factors, such as were there multiple community locations inside of these neighborhoods that would really benefit from having additional supports. So for instance, one of our Russell sites includes a school and a park and multiple areas where community want and need to be able to go and have safe, healthy places to commune. And so as we look here, we can select all of our CVI sites where we are doing on the ground intervention work. And this showcases the neighborhoods that we're in: Algonquin Park Hill, California, East Russell, Jacobs Wyandotte, or otherwise known as Taylorberry, Newburgh, and West Russell. And if you take a look, and right now we have multiple selections, so we're still on homicides and non-fatal shootings, you will see that year to date, we have a reduction in violence by 41%, almost 42%. And that is on top of a year, last year, that was at 30%. So when we look at this, in 2024, this time, we had 67 victims of gun violence, fatal and non-fatal. And this year we're at 28. We have a lot of work to do, but I do want to showcase that is a tremendous amount of improvement. Now, if we take off non-fatal, oh, sorry about that. We can see that homicides have reduced in those 6 CVI sites combined by 61%. So these neighborhoods have a radius of approximately a 1-mile radius where we have street intervention inside there, and they are working day in and day out. And this work has shown and proven successful. And that is why we have remained in these neighborhoods and even expanded the program. I'm going to show you one other data point before I continue on with the slides. Let this load up really quickly. So if you take a look, we have the ability to also see how violence is affecting our victims in regards to age groups, in regards to male versus female, and then also race. You can go up and navigate and utilize all of these different pull down boxes if you want to zero in on a specific area. If you want to look at CVI sites specifically, you can even look at crime type. And so I would really suggest that if you want to navigate this, if you are struggling to do so, give our office a call. We would love to help you do that. But I'm going to continue on with the presentation. I just wanted to sort of tee up how much work has been taking place in the city. And let's see if I can navigate swapping out to a different.
You have 7 to 8 minutes to finish your presentation.
Sure. And I can get through that. I really wanted to show the data though. Are you all seeing my slides at this point? No, okay. Well, we've all seen that technology is clearly not my strong suit. Almost back. Here we go. Okay. Are you all seeing program and service divisions?
Yes.
Okay, perfect. So with 6 minutes left, I'm going to fly through what we do and showcase how the efforts inside of our office are contributing to this significant reduction in violence. So we have intervention services division, a youth and family and community division, as well as data intervention and special projects. They are the creators of this dashboard. In our intervention services, we have multiple components that actually together holistically create an intervention program. So our community violence intervention, we work with Goodwill. They have street outreach. Those street outreach are in the 6 different neighborhoods that I showcased that 60% reduction year to date. They are working with individuals day in, day out to decrease conflict before it arises by working in the community and being credible messengers. Many of them have justice involved past themselves and have navigated into an incredibly healthy life for themselves, and they are now passing that forward. When they interact with an individual that we would consider risk involved or someone that meets 1 of 2 of 7 criteria, they will then give a referral to our outreach inside of the Office of Violence Prevention. The outreach inside of inside of our office will then do case management with that individual for approximately 12 months. And that will continue to work with that person on a voluntary basis to get them connected to things such as employment, mental health and behavioral health services, navigate issues that many of our folks have, which is just things such as getting an ID and a birth certificate so that they are able to potentially receive supports that they need. They also connect them to other community organizations and get them plugged into healthy supports in the community. Another way that we are connecting with our highest risk individuals is through our hospital-based violence intervention program. And when a victim comes in from gun violence, the Office of Violence Prevention supports caseworkers inside of the hospital that are able to connect with that victim immediately. And we know that at that point, that is the most likely a person is to truly decide to make a change. And we also have research that showcases having a case manager working with a victim in the hospital increases that victim's likelihood of sticking with their treatment at the hospital and also connecting to resources outside of the hospital. Many times those individuals will then go on to get outreach case management from our office. For our lower risk individuals that we come into contact with, either through street outreach or with our office, are able to connect them to supports through Volunteers of America. And we also have reentry services and critical incident response coordination, which is something that takes place after a shooting in a neighborhood. We have a plan to have our community violence intervention go out, strategically go through the neighborhood from front to back to reduce any likelihood of retaliation, because this just continues to impact community. And then we take referrals from GVI, which I don't have time to go through that, but GVI is where LMPD has identified our most risk involved individuals that are group or gang involved and gives them a decision that they can choose to take us up on supports and services to navigate a healthier life, or there will be consequences should they continue. What do I have, about 3 minutes?
Yes.
Okay. I think I already went through how we are using a public health approach, but everything that we do is through the lens of public health and understanding that reducing trauma, reducing continued exposure, connecting people in under-resourced neighborhoods to resources and employment is bettering not just their health outcomes, but the community as a whole. So our other division is youth, family, and community. And this is really where we're working on ensuring that our youth have healthy places to interact with one another. We are ensuring that social cohesion inside of neighborhoods is strengthening relationships and also utilizing this opportunity to work with individuals on healing. One of the things that our office does is go out for community sanctuary. We call it a community sanctuary project, but anytime there is an act of violence that was significantly impactful in a community, and an example of this could be if a youth was a victim or if there were multiple victims, then we lift up Community Sanctuary Project. It offers the ability for community to come together, heal together, have access to mental health supports, have access to faith-based supports should they want that. And also there is outreach there should there be any individuals that have made a decision they want to change the direction of their life. And we are always connecting people to resources through VOA, as well as different programs that we have. Something I'm really proud of is that our office has been extremely intentional about raising youth voice and giving our youth healthy avenues to share out about their experiences. We've done this through Photo Voice, which has given them opportunities to take pictures of things inside their community that have impacted them and then tell a story to go along with that. They have had the opportunity to educate community leaders and also community organizations to assist them in better serving our youth in the ways that they feel would be most impactful for them. And all of our programs come through a trauma-informed lens. We even do trauma training to multiple organizations across the city to ensure if they are serving our youth, they are doing that through a lens of trauma. Data innovation and special projects. I ran you all through the Louisville Gun Violence Dashboard. Please reach out to me if you would like me to walk you through that further. It really does give a wonderful picture as to what is taking place in our city. And again, I cannot state enough that this is a collaborative effort across every single agency, every community partner. And so it's been an honor to be able to work on ensuring that people have healthy supports and are able to navigate systems. I'm going to close out with this, and it is not accurate, and I wish that I could put the accurate one up here, but I'm not going to steal Ivan's thunder as he is going to be sharing that out very soon. But the economic impact anytime we have a fatal shooting in this city is at this point well over 934,000. It is horrible to talk about someone's life in regards to economic impact. That does not feel good to say, but it is a reality. And the reality is the programs that we are investing in, when people look at return on investment, it is by far, and you all saw the reduction in violence that we are seeing paying for itself. In addition to that, there is no price that you can put on the emotional and community impact that takes place anytime there is gun violence in a neighborhood. Every single time it, again, creates trauma for the entire community. And this work is truly breaking generational cycles. And we are very proud to have the ability in the city to do this work. So if you all have any questions, I will open it up for that. I apologize about my technical issues, but I am glad that I was able to finally get that dashboard open.
Thank you so much, Ms. Webb. Do we have any questions or comments for Ms. Webb? And thank you so much for ending your presentation. And this last slide is impactful and brings to the table what is the most important thing to consider: lives and the involvement of the community. Dr. Ransdell.
What was the website, Ashley?
Yeah, it's the Office of Violence Prevention, and you can get to that by going to by just going to Louisville Metro Government. And then you can click on Office of Violence Prevention, or you're welcome to click on LouisvilleKY.gov. But then it's
Okay.
/government/office-violence prevention. So it's really easier just to get there, LouisvilleKY.gov. On the left-hand side, after you've clicked on the Office of Violence Prevention, there will be a dashboard link. And on the left-hand side, you can navigate. There are multiple different tabs that showcase the data in different formats. If I had longer, I would walk you all through
Ms. Kathy
all of
Turner
those.
just shared the link, Dr. Ransdell. You can copy paste from the messages. Do we have anybody else? Dr. Eccles?
Oh,
I think Connie was first.
Oh, I'm
either
sorry.
way.
I'm sorry, Ms. Nando. Go ahead.
No worries. So Ashley, could you just provide information how this board or others could support the Office of Violence Prevention?
Yeah, absolutely. So I think that anytime you all have the ability to share with us additional resources that we can connect our clients to, that would be extremely helpful. Anytime that any of you all know of people that have been impacted by violence and could use additional supports, we are always there. If you know of individuals, and this is one that's very near and dear to my heart, we have a lot of grandparents raising grandkids right now in this community. We have a lot of grandparents that are doing everything in their entire power to keep their families safe and intact, but they do not have the resources or the human support to really navigate what's in front of them. And if you know of any grandparents that are raising specifically teenagers that are becoming heavily involved with peer groups that are not safe, those are exactly the individuals that we want to be connecting with. We not only work with the individual, but we help the entire family. We can connect them to family supports, wraparound supports, and we also are able to reduce some of that burden off of grandparents because we are taking on some of the challenges that we see our teens facing today, with helping them navigate social media and assisting them in getting connected with mental health and behavioral health supports and walking alongside them as they do it. Again, our outreach, they are trained, but not only that, they have the ability to interact with these youth in a way that they're connecting to them. So please use us as a support. And then anytime that we can come alongside you all, specifically when it comes to social media or any topics that we're noticing right now that are influencing our youth and our families well outside of the screen. We are seeing things taking place on screens now that are translating into stuff in the streets that we would really love to come alongside of this group and navigate that. I would say those things, and then just educating people that this type of work is being done, and that taking a public health approach to so many of the issues in our community is, in my opinion, the right way to go about things, addressing root causes.
Thank you. That's helpful and very actionable. I appreciate you.
Yeah,
Thank
we
you.
appreciate you all so much for all the work
Dr.
you do.
Eccles? Dr. Eccles, go ahead.
So I first want to say that your office is so important and so vital to our city. And I think that um, you know, recently and looking at the dashboard and seeing the numbers and seeing the facts, especially when it comes to non-fatal incidents, is really encouraging for me personally. I live in Newburgh, so I see for and I have young children, so I kind of see firsthand the impact that social media and just the culture and things like that have on our youth and on how they interact with each other and with the world around them. And I think specifically Louisville has kind of gotten this, there's this narrative in the media that, our younger population, especially the younger African American population in the city, and maybe not just youth, but, young adults, kids, people that are in their, formative years and up and coming age, there's kind of like a narrative or a stigma and a stereotype around how they portray themselves in public and how they interact with the rest of the city. And I just wonder if you all have any kind of messaging or any kind of programs in place that kind of address that are getting out the fact that you are doing good work and we are seeing positive impact and there is change happening in Louisville, positive change that's happening in Louisville that our young people are a part of, that, the Louisville Metro is a part of, and really working towards like establishing these partnerships and improving things, so to speak, in the city. Do you all have like, I don't know, I guess like PR around that, or just kind of a way to get that messaging out that, what you see on Instagram and like, that story from last night on Bardstown Road or whatever happened is not the full story and the full scope of the city.
Yeah, and I'd love to speak to that. So everyone on this call knows that, someone sees one thing that's negative, it really takes seeing something positive about 10 to 15 times for people to believe that. So our city getting safer, and then it is one thing, and that is the most important thing, that we are truly making the city safer. But then for people to feel it and acknowledge it, that takes much longer. And so I think I want to ask everyone that does this work day in and day out in the lanes that you do it, don't get discouraged. And I'm saying that to myself too. We did and are doing stories as much as possible and trying to get the message out as much as possible. But to your point, the reality is last week, and I didn't look at the data this morning, but last week, our youth, 0 to 17, we are seeing a reduction in gun violence, homicides, and non-fatals by 46% year to date. 46%. We have had 6 youth victimizations this year in comparison to, and please don't quote me on this number, we have the dashboard. I believe it was 29 incidents just 2 years ago. Yes, we still see youth out and creating youth things. And are we continuously doing everything that we can to be in those spots, to come alongside LMPD in the ways that are appropriate to reduce that? Absolutely. But am I personally extremely proud of our youth? And knowing what they're up against right now with social media and things that none of us ever had to navigate? Absolutely. To see that they are reducing by 46% year to date, even with the narratives, to your point, that are saying otherwise, kudos. And I personally love being in community with youth. That is my favorite part of the job, because I don't feel like I'm working when that's the case. And I have seen recently more advocacy coming out of youth, showing up for themselves in places like, we had a youth summit, and they have the opportunity to develop and create what they want to see programs look like for themselves. If you go into our community centers, our kids are flooding those. They are looking for healthy adults to connect with. And so I hate to say this because it's not going to sound positive, but our youth are showing up. We need more healthy adults showing up, walking alongside of them. We need more people stepping into volunteerism. We need more people going into neighborhoods that maybe they never have gone into before. Because I can tell you, I get beyond great joy taking my own kids with me into the community centers and just being a presence, because our kids are begging for that. And so I guess what I would say, to piggyback on to the last thing, is there anything that this board can do? Please let people know not to underestimate the ability that they can have just by showing up in a youth's life. Our youth want to do the right thing. Our youth want to have good places and good opportunities, but it's our job to connect them and to also be available. So I think that we just need to continue to collectively remind people that what they're seeing, yes, we will continue to address that, but it is not the full picture. And that's why I spent so much time trying to pull up that data dashboard, because I want to let you know you can go on it and you can actually look at victimizations 0 to 17. You can be informed yourself so that you have the ability to share out that narrative in a way that is connected to real data.
Ms. Margolis, this is the last question. You are muted. You're still muted. Just type your question, Ms. Margolis. From Dr. Mitchell, she completely agrees with Ashley. Louisville Metro Public Health and Wellness participates, and let me see. I lost my message.
Oh, I'm on.
Yes, go ahead, Ms. Margolis.
Okay, I am a lifetime resident of the Highlands, and there's been a lot of work done on the bars on Bardstown Road, etc. However, people are coming into the community, into the Highlands from other areas. I strongly believe that a job and economic well-being helps with this issue. And so I would certainly encourage that, because I've always thought that having a job is the gun out of the hand. And but the area that I've called home for 72 years has issues right now, and everyone is working to solve them. But I would encourage a good relationship with economic development related parts of government to redirect or strengthen those bonds.
I thank you for bringing up that comment. I have two quick things to state to that real quick. One of the highest priorities of our office is anybody that we're working with, the first thing we want to do is connect them to behavioral and mental health supports, because a lot of times we know that we need to address those challenges before we can navigate any of the others. But after that, we have extremely strong partners, and I want to completely acknowledge what you're saying. The goal is always to improve our ability to connect people to employment opportunities. But Louisville is very lucky in the sense that we have community partners such as the Spot that will work with any population, reentry, people that are in the midst of struggles. And they don't just connect them to employment, they walk them through things to be successful once they've entered employment, such as life skills and interviewing skills. And these are very successful programs, and we work extremely closely with ensuring our clients navigate through there. We also connect to you through the Summer Works program, and are lifting up stipend programs in neighborhoods that we know our youth potentially don't have the ability to transport in and out of their neighborhoods due to lack of transportation at the current moment for them. And we lift up some programs that have stipends, and we notice that those fill up and also teach them skills and also teach them work ethic and get them connected to other healthy peers. So I completely agree with you, and would also state, yes, we are going to continue to grow and expand in the opportunities that we have specifically to connect our highest risk populations to employment.
And one last piece, and hats off to Nicole George, Deputy Mayor, for increased oversight and parks. I'm going to call them patrol, but I don't mean it in a negative way, but supervision in the parks, because that is also a place where all of that transpires.
Thank you very much. Dr. Mitchell agrees with you regarding that Louisville Metro Public Health and Wellness, along with Louisville Metro Police Department, on the Combos and Cuts monthly barber shop community meetings, they have seen young people showing up at those spaces. So thank you, Ms. Mendel, for the calling and what can we do as a group, as a board, and also as a part of the community. The call has been made. There are community centers in need of grown-ups to model, to walk along, and to accompany these kids. And thank you so much for this presentation, Ms. Webb. We appreciate the call to action, and we will be partnering the best way we can.
Yes,
Appreciate it.
thank you so much. And last thing I want to state is that we hold a volunteer list to be able to connect volunteers to opportunities in the community should they not have any idea where to do that. So if you don't know where to send somebody to, always feel free to send them our way, and we will ensure that they get plugged in ways that they want to. Thank you all so much. Thank you for the work that you all do and for being amazing partners.
Thank you very much.
Thank you.
Since we know that Ms. Margolis is gonna have to go early, at the end of May of 2026, U of L announced a new scholarship funded by Humana Foundation honoring alumna Heidi Margolis and her journey of positive community transformation in Louisville.
Yeah.
The scholarship will be awarded for an undergraduate student at the School of Public Health and Information Sciences, and this is starting this fall, 2026. We are so proud and so pleased. Congratulations, Ms. Margolis. Congratulations. So we will continue with our agenda, and we will allow time for updates and reports. For the Mayor's Office update, now I yield the floor to Deputy Mayor Nicole George. Deputy Mayor.
Good morning. Well, certainly so much to celebrate this morning. So congratulations to our new chairs, to Heidi, and of course, Ashley Webb. Her presentation was great. So good to see progress and yet also see opportunities to continue to advance the work. So excellent way to start the day. I'll be brief, just really two things. In the mayor's office, we are focused on extreme heat. Obviously, that is before us this week. Shout out to the health department for all they've done to help educate. The Office of Social Services has helped support with both fans, passing those out through fanfare, but also in addition to Neighborhood Place, there's still fans available. Also with Heart, they're out with the water truck. Also, with communications and advancing cooling centers and really just where people can get better tapped into city services, taking advantage of what currently exists. So a lot of work concentrated on that. The second thing I want to mention is that Ujima Neighborhood Place is going to have their reopening, their ribbon cutting in July. As part of that, I know Mayor is going to want to spotlight progress we're making with Medicaid enrollment. And so I'm looking forward to getting a good update to hear where we are with numbers. So I'll be listening with a sharp pen. So thank you guys, and I look forward to hearing updates.
Thank you so much, Deputy Mayor. And for the director's update, I would like to celebrate our very own Louisville Metro Public Health and Wellness Chief Health Strategist, Connie Mendel, who has been named a 2026 Alumni Fellow for the University of Louisville School of Public Health and Information Centers. So this recognizes her outstanding leadership, integrity, and impact in advancing public health in our community. Congratulations, and we are so very proud of you. Now I yield the floor to Ms. Connie Mendel, our new celebrated award recipient.
Thank you.
The floor is yours.
Thank you very much. I am certainly in good company, so I appreciate that. Everyone has a copy of the chairs or the board of the report to the board from the director. So these are mainly reminders. As Deputy Mayor mentioned, it is summer, so we are certainly concerned about the heat and taking care of people. So please reach out to others. Be sure we're checking on our friends and our neighbors, and just making sure that they're staying hydrated and getting proper nutrition. With it being summertime, it is mosquito season, as we know. It is not unusual for usually this time of year, that we see, unfortunately, West Nile mosquitoes, and then later in the year we're hoping to prevent any human cases of West Nile. So please encourage everyone to do what they can to avoid mosquito bites, whether that's wearing an EPA registered insect repellent, checking standing water in and around your home, and repairing any type of screens or other things that would allow mosquitoes into your home. So really concerning. Please be vigilant on that work. The other thing with summer, a great way to cool off is with the pool or any of our local spray pads. So our team does a lot of work inspecting those and ensuring they're in good working condition, and making sure that there is no bacteria in the water. So a big shout out to our team for the work they're doing there. And just also as a reminder, with summer we travel a lot. Make sure that your immunizations are up to date, particularly measles, considering the outbreaks of measles that we've had recently. So, again, make sure that your immunizations are up to date. And it's a good idea to check ahead of time of where outbreaks are happening in the country. There is a link in the report to where you can check that. The other thing I did want to celebrate is next month, but it's officially July. So later this month, the National Association of County and City Health Officials, NACCHO, as we refer to them, will be in Louisville. They're having their National 360 Conference, which begins on July 16th. So many of the health department staff will be participating in this conference. It's an amazing gathering of health and officials from out the country. And 2 of our teams have been awarded Promising Practice or Model Practice Awards. So there's information there. Super proud of our team members as always. And lastly, I will share, as I'm sure everyone has seen in the news with the Ebola outbreaks going on in the Congo and Uganda, your health department is following travelers, anyone returning from those areas to the Louisville area. We are doing daily check-ins with travelers. We don't have anyone who's returned to this area that's at high risk. Fortunately, those residents who have returned to the Louisville area are low risk, but we will continue to monitor and check in with them, ensure that they don't begin to experience any symptoms, and just check on their general well-being. So there's lots and lots of information in regards to Ebola within our website, within obviously the CDC. It is important to note for anyone traveling in that area, we have several churches that in the past that have done mission type trips to those areas. So you really want to know what the requirements are and the restrictions are when returning back to the U.S. And thank you.
Thank you very much, Deputy Mayor. Now we go to Family Health Centers. Now I yield the floor to Mr. Sam Brady.
Thank you so much, Dr. Batista. And Arlene, I don't know if you have the ability to share my presentation. Otherwise, I can share.
We have it, but if you would like to share it, you can.
Okay. Go ahead and share that. All right, so can everyone see my screen just to confirm?
Yes.
Wonderful.
Yes, sir.
All right, so good morning, everyone. This month, I want to give you an overview of kind of where we stand across a few key areas. The first being what we believe is a major capital milestone with our Americana partnership, an early stage concept to potentially expand medical respite care for our community members that are experiencing homelessness, and to look at where our community's Medicaid coverage numbers stand through the end of May, right? In regards to our Americana Health Center groundbreaking, on June 18th, we did break ground, and this is on a new integrated health center, right? This has been a result of years of planning, and it represents a real investment in culturally responsive care for Louisville's immigrant and refugee communities, as well as those that are underserved. Construction is currently underway, and we believe it'll take approximately 12 months for which to complete construction. I'm presently working with the leadership at Americana and their board to finalize the various lease and grant agreements. And those are being finalized this summer, hopefully this month, with the target to have both instruments executed by August 1st. And we believe ultimately that this is one of the clearest examples of FHC meeting the communities where they are, right? Being physically located and providing that care that's so desperately needed inside a trusted community hub. Next slide. All right, so a quick update on our community care campus medical respite. So this potential program is a program that we're looking to expand upon that's already currently running, right? Today, we serve up to 20 patients experiencing homelessness that can recover safely in our facility located at the Hotel Louisville. It's a collaborative operation that we have with Wayside. And this is presently after they encounter a hospital stay. And these are people, our community members who would otherwise be discharged with nowhere safe to continue healing. We're in the early stages of exploring this expansion of our program at the community care campus, or what we call the C3. We're looking at a larger footprint, potentially as many as 29 to 30 beds. The concept is still in development. We're actively working through the particulars, be it the operating model, staffing, and ultimately how it will be funded. Why does this matter to this group? It's very important to convey that the individuals in our community that are experiencing homelessness are often discharged from the hospital with nowhere safe to recover, right? Without a stable place to heal, many end up back on the street and ultimately back in the ER, the emergency room. And we believe this medical respite gives them around the clock, 24/7 supervised care so they can recover safely, which also means fewer avoidable ER visits and readmissions. And a safe place to heal keeps our most vulnerable neighbors healthier and reduces the strain ultimately on the hospital system. Our next step at this point is to convene a small work group. We have received confirmation from our board. This work group will include FHC leadership, obviously, Deputy Mayor Nicole George, representatives of the Volunteers of America, specifically Matt Reed, with the idea of keep exploring and refining the operating model, refining the partnership and the funding, right? And we'll have a clearer picture of those conversations as we progress, and I'll continue to communicate and convey where we stand with regards to that project. Slide 3. This slide is an environment we're currently operating in, and I just want to provide the group with a little bit more context before I pass it over to Ashley Shoemaker, who will do a deeper dive. But since adult Medicaid recertifications began in April of 2023, adult enrollment in Jefferson County has dropped nearly 29%, or roughly 53,000 fewer adults covered. Children's recertification started in June 2025, and we're beginning to see that number decline as well, down about 11% so far. So every percentage point represents families losing coverage. And many of them are still qualify, but are getting lost in the paperwork, or what we call procedural churn. And that's a reality behind the demand we're seeing in our clinics with the increase in the uninsured patients. And it's why programs like medical respite or community partnerships that we have with Americana matter so much more, right? So I'm going to stop there before I turn it back to Ashley and Dr. Batista, and I'm happy to take any questions or provide any additional commentary.
I just have a question before you continue, Mr. Reddick. How
Sure.
can the community help to prevent or to reduce this number of people? I know that working at our at the organization where I work, and nonprofits, you can just bring to the table and remind community members to check their mail and contact connectors. But is that all we can do to support the community to decrease this drop in numbers?
Yeah, that's a great question, Dr. Batista. And ultimately, I think it's, continuing to have a clear and consistent and concise message to those that are maybe most vulnerable or at risk of losing coverage, in terms of making sure that their address on file is accurate, making sure they're on the lookout for any specific documentation that they may receive from the state, and then ultimately linking them back to the family health centers, because we have about 9 to 10 outreach and enrollment staff that work directly within each of our clinic that also do community outreach that can help walk them through or shepherd them through that process. And ultimately, I don't want to steal Ashley's thunder, but she has a dedicated team that can help walk them through that process and make sure that they have that continuous enrollment. And it's not just for Medicaid, right? We can help them to work through qualified health plans on the Kentucky Exchange, the insurance exchange, to make sure that if they're not eligible for Medicaid, maybe there's another viable option for them to continue to be covered.
Thank you, Mr. Redick. Now, Deputy Mayor, do you have a question? No. Now
No,
we
this
can,
answered it. Thank you.
thank you, thank you. We continue with healthcare coverage and outreach. Now I yield the floor to Ms. Ashley Shoemaker. Ms. Shoemaker.
Yes, and one other thing that I would add for, especially for families, when you're working with families, the income limits for Medicaid are much higher for children than they are for adults. So we see a lot of families who, their income has changed, and so they assume that they don't qualify anymore, but the children could still be eligible. So we want to encourage people, even if you think you might not qualify, it doesn't hurt to go ahead and submit that information and let the state make that determination. So if they do get that letter in the mail and they think that they're not eligible, submit that information anyway. I know it's additional paperwork, but the kids could still be eligible for Medicaid. So that is one other thing that we can do as we're working with families in the community. Some updates for Medicaid. As I've mentioned previously, there is a change for Medicaid eligibility for some immigrants. So starting October 1st, immigrants that are eligible for Medicaid, it will be limited to lawful permanent residents, Cuban and Haitian entrants, and COFA, or Compact of Free Association migrants. Pregnant women and children will still be eligible for Medicaid as long as they are lawfully present. So the state has sent out notice to Medicaid members who are at risk of losing coverage starting in October. They are requesting that they submit their proof of their immigration status again, because there could be some people who have had an adjustment of their status. They've obtained that lawful permanent residence, and they are eligible still. But if the state does not have that paperwork on file, they could lose coverage even though they still qualify. So those letters went out last month. So again, as people receive those letters, they should respond to them as soon as possible, upload those documents. They can reach out to a connector and we can assist them with submitting that paperwork to prevent them from losing coverage. Or if they no longer qualify, we can explore options for a qualified health plan to help them enroll in other affordable health insurance. The other big change is the Medicaid work requirement, or what is being called the Medicaid community engagement requirement. That begins on January 1st, and the state is sending out notices to members on expanded Medicaid this month. Just giving them that initial outreach, letting them know that this is coming and that they may be subject to this Medicaid community engagement requirement. So people should be on the lookout for those letters. And if they have questions, they can reach out to a connector. The CMS did issue their interim final rule to states. That was the guidance that they were waiting on to finalize their plans for the community engagement requirement. There was one place where the interim final rule sort of deviated from what CMS had been discussing with states previously, and that is in regards to the medically frail exclusion. So if someone is considered medically frail, then they do not have to meet the community engagement requirement. I believe states had been under the assumption that they would be able to use diagnostic codes and data to exclude people automatically. But the interim final rule, it says that a diagnosis alone is not enough to exclude someone, that states will need to also be able to show that because of that diagnosis, the person is unable to work, volunteer, or otherwise meet that community engagement requirement. So that means that states, they will need to look at the severity of the diagnosis. They will need to look at claims and prescriptions or other factors to determine if someone is considered medically frail. It won't be quite as simple as I think states were expecting. So they are working on finalizing those plans. That those algorithms and that logic will be made public. It will be publicly available once the state has finalized those plans. And for the first year, for 2027, Medicaid members will be able to self-attest to their medically frail status. So for that first year only, they will be able to sign a statement saying that they are medically frail. But then at their next recertification, they will have to prove, submit documentation that they are medically frail. But that should give people a little bit more breathing room because January will be upon us before we know it. So the coalition, I had to cancel the June meeting, unfortunately, but our next meeting is for August 10th. We won't be meeting at 4 o'clock. So does anyone have any questions for me? Okay, thank you.
Thank you very much, Ms. Shoemaker. We don't have any updates on behalf of the Immunization Advocacy Committee. JCPS has had some changes on the health department section of the district. So we're just waiting to find out who's going to be our contact or will continue to be our contact for the next months. For Greater Louisville Medical Society, I yield the floor to Dr. Chris Jones. Dr. Jones? I see him on the meeting, but probably he's unavailable. We don't have any updates for him, and neither for Kentucky Nurses Association or the Greater Louisville. Regarding all businesses, we have been meeting often in virtual meetings, but there's an invitation to meet in person more often. So we will send a survey for to share with us your availability and the preferred timing, if it's 7:30 or 8 a.m. And so be in the lookout for that survey. And please remember that for summer break, we won't be meeting in August. So our next meeting will be a virtual meeting on Wednesday, September 2nd, 2026. And please, boards, remember we have been called to actively participate supporting Louisville Metro Public Health and Wellness strategic plan. I had the opportunity to present a proposal for congenital syphilis prevention at this year's Louisville Metro Office for Women Ambassadors graduating program. And the idea is to support the creation of board review that Dr. Bryan was mentioning on her presentation. And also there's a discussion and proposals also for Louisville Metro Public Health and Wellness. So keep this in mind. Think about the calling that we just received from the Office for Violence Prevention. And let's think together and individually how can we make a difference? How can we be more active as a board, as individuals regarding the public health for our city? And if there is no more comments or contributions, thank you everybody for taking the time to participate in this month's meeting. It has been an honor for me to serve as chair for the last couple of years. I'm really grateful. I have learned a lot. I have experienced a lot. And the next meeting will be on Wednesday, as mentioned, September 2nd, 2026 at 8 a.m. This meeting is officially adjourned. Thank you very much.
Thank you.
Thank you. Thank you.